September is World Alzheimer's Awareness Month, and it's a good time to focus on the millions of Americans living with the disease, which is the most common cause of dementia among older adults and one of the leading causes of death among adults 65 and older in the U.S. But there is hope for patients who are in the early stages of the disease these days. Patients like Jonelle Dersham and also her doctor, neurologist, Dr. David Wiseman, to join us to talk about their experiences. And thank you so much for being here. I have been affected by Alzheimer's in my family. I know so many people have, so very interested in what you have to say. And Dr. Wiseman, let's start with you. What is early Alzheimer's disease? How is it different than normal aging?
Normal aging is really just kind of tip of the tongue symptoms, hand me the thingamajig or whatchamacallit. But Alzheimer's disease, on the other hand, is a slow brain disease that starts affecting memory primarily and usually, where people just start forgetting conversations, appointments, things like having trouble with handling finances. And that really distinguishes this brain disease, which is caused by the slow buildup of these abnormal proteins in the brain, from normal aging.
Why is it important to diagnose Alzheimer's early?
Because now we have a treatment that slows down the course of the disease. And we're here partnering with Eisai and Biogen to raise awareness about exactly that fact. We now have this treatment, Leqembi, that slows down the disease if it's caught early.
Yeah, there's some really interesting research going on into Alzheimer's that I've been keeping an eye on. Jonelle, explain your journey with early Alzheimer's disease. What were your first symptoms?
I was struggling to gather my thoughts at times, and was having problems with dexterity in my job as an OBGYN doctor, and I was kind of losing my confidence in my surgical skills. And I knew I had a grandfather that had Alzheimer's disease, so I was concerned that I had a neurologic condition. So I told my family that I wanted to see a neurologist, and we made an appointment. And when I saw Dr. Wiseman, I was confirmed to have the diagnosis of Alzheimer. But he also talked about Leqembi, and he said I was a good candidate for it. And I've been on it since June of last year.
Dr. Wiseman, can Alzheimer's be treated?
Yes. Leqembi lowers the protein that causes Alzheimer's disease. And by doing so, it prevents it from sticking on the nerve cells and making them dysfunctional. So the more the nerve cells stay healthy, the better people do over a long period of time. And this is a very slow disease, so we're talking about folks who are able to maintain independence for longer, do their hobbies and whatever they want to do, pick up the grandkids, pick up the kids for longer.
Yeah. Are there any safety concerns?
Yes. No drug is without side effects, and the drug can cause brain swelling. And we typically want to monitor that with MRIs to make certain that that stays asymptomatic. And it can cause symptoms, but those can be managed during the treatment with either dosing interruptions or other treatments. It can cause allergic reactions, infusion-related reactions as well. And that's not a complete list, but that covers most of it.
Okay. Jonelle, tell us about your experience on this treatment.
I get an infusion every 2 weeks, and it lasts about 2 hours. And I really haven't had many side effects. And I do believe that I've really maintained not quite a status quo, but I really feel like I have a lot more hope that I'll be able to see my kids graduate from college, get married, have a family, maybe meet some grandkids. Mm-hmm. And that really made a big difference in my outlook after I was diagnosed.
No, I'm hoping that for you as well. What is the most important thing you could say to people who are dealing with an Alzheimer's diagnosis?
To have hope and just I guess that have hope.
Yeah, to have hope and seek treatment. It sounds like very early can really make a difference. Dr.
Yes.
Watson, where can people go to find out more information?
Best place is probably your healthcare provider, your doctor, primary care doctor, or neurologist, geriatrician. And then there's a website, leqembi.com, leqembi.com.
Okay. Dr. Weissman-Jonell, thank you so much for sharing this experience. I know it affects so many families, and I'm sure they'll appreciate this information. Thank you.
Thank you.
Thanks for having us.